Thank you for joining me for this training on writing test items for AAN examinations. I've had the privilege of guiding many subject matter experts in the writing of test items for AAN examinations over the years. This recorded training is designed to inspire and assist you in writing excellent test items and to guide you in reviewing your first drafts to ensure that you don't stumble into any of the common errors that would detract from the overall excellence of your test items. The outline shown will be covered in this training: why excellence matters, benefits of multiple choice question format, validity and reliability, anatomy of a test item, clinical vignettes, and excellent examples. Correctable issues that are frequently seen in the first drafts of test items are shown on the slide, and I will explain each one during this training. If you've been invited to write items for an AAN examination, I hope you embrace the challenge with a desire for excellence. In addition to building the reputation of the AAN, your items can shape the way your colleagues and peers learn and practice. The AAN has a long history of excellence in the development of educational assessments. Each examination is composed of items that were crafted intentionally by busy professionals for busy professionals. The care that you take to ensure your test items are excellent will be reaped by many of your colleagues. The usefulness of a test is always measured by the quality of each test item. The multiple choice format for test items has been used by the AAN for decades because it has so many significant advantages over other item formats or types of tests. These items can be scored objectively by computer. Computer scoring is efficient and accurate. The careful development of the items takes time on the front end, but provides time savings following administration. Computer scoring for right-wrong is not subject to many of the sources of error introduced through subjectively scored formats. Additionally, the time savings for examinee responses allows for greater breadth of content to be tested within a reasonable time period than what could be covered in other formats. Validity. The most important consideration for your test items is validity. Does your test item measure what you intend to measure? If you leave clues to the correct answer in your item, you may be testing how test-wise the examinees are instead of testing knowledge of neurology. First drafts of test questions frequently include clues about the correct answer, but these kind of flaws can typically be corrected quickly and easily. Some issues that will impact the validity of your items are whether your item actually fits under the category of the content outline you were assigned or the category you intended to write. It is best to start with a category and write an item to address it rather than writing an item and then trying to make it fit within a category of the content outline. Is the topic of your item important? That is a validity question. Think about the objective of your item. Why do you want to be sure that examinees know the answer? Reliability. We talked about validity first because if your item doesn't address an important topic, it won't matter whether it's well written from a technical perspective. But assuming validity, reliability is a critical consideration because your item will fit within the whole of an AAN test. The test is intended to measure a body of knowledge consistently and accurately. If the AAN chose one collection of items versus a similar collection of items from one of their item pools, we should be able to expect an examinee to have a similar score or result, regardless of which collection they answered. The reliability of a test is impacted by the quality of the component items. Let's talk about the anatomy of a test item. Having a common lingo for the pieces of the item will help us stay on track in this training. The first part of an item that asks the question or poses the problem an examinee must address is the stem. The most common AAN structure of a multiple choice question includes 5 options, from which the examinee selects his or her answer. The correct option is called the key. The other options are called distractors because they are equally distracting to someone who doesn't know the content. It should never be your intent to distract physicians who know the correct answer. Your item should be clear, never tricky. There should be one answer that is the key, which can be verified in a reference and agreed upon by a group of subject matter experts. It is a common error to write an item that has more than one key. Your discussion should be interesting and informative to examinees who know the key and to those who do not. Discussions address the key and distractors, not just the key. The term discussion is used because the information extends beyond citing a fact from the reference. Use it to show interrelationships among concepts covered in your STEM and/or the options. The reference is a valuable part of an item. Examinees can use the reference to seek more information about the topic, whether they answered correctly or not. Examinees pursue additional learning in topics that interest them, challenge them, or contain new ideas. The AAN uses references to verify information in the items, ensuring correctness. The source and date of the reference are particularly important to maintain item information over time. What constitutes a good reference will vary by topic, but typically a current reference that is widely accepted by subject matter experts is used. Some authors like to write a clinical scenario and then develop more than one item for it. AAN refers to these sets of items as clinical vignettes. I will caution you that writing a vignette is difficult to do well because each item is scored independently. Examinees should have a fair chance to answer the second item of a vignette correctly, even if they did not know the correct answer for the first item. So if a writer asks for a diagnosis and then a treatment, the second item is difficult to answer correctly if the first item was missed. However, some content does lend itself to the clinical vignette format, and an example is shown on the next 2 slides. Here's an example. A 25-year-old woman is brought to the emergency room because of seizures, as described by family and EMTs who witnessed the events. When she presents, she states that she's relieved to finally be able to be treated by the best doctor in the world, and she is convinced that the neurologist has the expert clinical skills to diagnose and treat her. There are multiple scars of different ages over both her wrists. She is admitted and monitored in an epilepsy unit where she continues to experience seizure-like events. However, there are no EEG abnormalities seen in conjunction with the events. On video, she is observed to enter into a seizure when she hears visitors or staff about to enter her room, and she stops when they leave. When the findings are reviewed with her, she becomes angry and calls the neurologist a fraud. She pulls off her EEG leads and leaves the hospital. It is later discovered that she has repeatedly displayed this pattern in several hospitals in the region. There are 2 items in this vignette. The first item's stem is the psychological mechanism that best describes symptoms production in this patient is, and the second item's stem is the most likely diagnosis is. In most cases, You will develop only one item at a time. Most items will require some clinical information in the STEM, so let's consider what information is typically included. In the items shown, we can pick out the age, gender, presenting complaint, duration, and then some studies. Common clinical presentations include age, gender, presenting complaint, duration. You might also include some patient history, physical findings, diagnostic studies and the results, treatments, and findings. Let's look at an excellent item example. The complete item will be shown across 5 slides. In the slides shown, we see the STEM. It's pretty long, so you will need to consider whether all the information is required to choose the correct answer. It reads, a 61-year-old woman with a prior history of migraines complains of a new type of headache, which is left temporal aching and accompanied by left eye pain and loss of visual acuity. On examination, her left scalp is tender. Her erythrocyte sedimentation rate of 55 has been attributed to a recent urinary tract infection. The neurologist requests a temporal artery biopsy, which has been scheduled for 1 week from now. Meanwhile, which is the most appropriate course of action? In this slide, we see the 5 options. Notice that all 5 options are treatment options. The discussion is shown on the next 2 slides. Notice that the discussion addresses the key and the distractors. The discussion continues and presents interrelationships among the concepts. A reference is shown in the slide. It's recent, but not so recent that it hasn't been vetted and considered by experts. Correctable issues. Even if your item is testing an important concept, there are issues that can detract from the overall excellence. Let's make sure you know how to identify and correct them. Unfocused stems make the examinee wonder what is being asked. It's an unclear presentation of the question or problem that is posed to the examinee. Examinees should be able to read the stem and think of an answer to your item before reading the options. Perhaps not your exact answer, but something similar. Test your first drafts by covering the options to see if an answer can be given before seeing the options. If you use a multiple true-false structure instead of a multiple choice format, the stem will lack focus. The unfocused example shown had some clinical information that's not shown on the stem, and then proceeds to, which of the following is true regarding the effect of corticosteroids in DMD boys? And the 5 options shown. This is not a multiple choice format, it's multiple true-false. Examinees read each option and decide whether each one is true or false. Examinees know the item asks something about corticosteroids and DMD boys, but what? So to correct this item draft, add focus to the stem and then revise the options accordingly. Here are some possibilities. What is the optimal age to start prednisone in DMD boys? Or what dose of prednisone is appropriate for this patient? Or which medication has a side effect profile similar to prednisone? Negative stems. Well, I will be the first to admit that writing items in the negative context can be faster and easier. But recall that we're shooting for excellence, and in the testing community, negative stems are viewed as less than excellent. We want to test neurology knowledge, not how carefully a physician reads in an examination setting. The negative context can be illogical. For example, when we ask, which medication would be the worst one to prescribe, or which treatment would be most harmful? This adds an unnecessary layer of complexity to the test item. A negative context can present an additional challenge for non-native speakers. The negative example shown is easily switched to a positive context. In most cases, you will switch the stem to a positive context, make the initial correct answer one of the distractors, use an initial distractor as the new correct answer, and then replace 3 of the options. Typically, it's faster simply to start with a positive context. Here we see the negative stem corrected. It's in a positive format, and the options have been changed. Contraindications, however, are an important part of practice. This is an exception, if you will, to the negative context guideline. The slide shows a negative example with the word not and a corrected example which uses the term contraindicated. It is unlikely that anyone would read over the term contraindicated, but they do sometimes read over the words not, least, and except. Many people agree to write test items because they are educators at heart, but teaching in the STEM adds to the reading time for the item. It can also give away answers to other items in the test on the same topic. Teaching belongs in the discussion section, not in the stem of the test item. The slide shows an item with teaching in the first line. In this slide, the teaching information has been moved to the discussion section. Possibilities for the new stem are shown. Do not put too much information in the stem. Include only the information required to answer the question. There may be other points that are interesting, but don't increase the amount of text in the stem. If you have interesting side notes or facts, you can add them to the discussion section. Heterogeneous options can give test-wise examinees an advantage in finding the key. The 5 options of your item should be homogeneous, that is to say, of the same ilk. For example, 5 treatments or 5 medications. Heterogeneous options tend to flow from unfocused stems. So let's look back to the unfocused stem example. The options shown cover a wide range of topics, including timing, dose, supplements, side effects. It's difficult to test all those concepts in one item. Focusing on one aspect per item is recommended. A possibility for the revision is shown. All 5 options would be medications. To make sure your 5 options are homogeneous, include a noun in the item that describes all 5. Instead of writing, which of the following is most likely to respond to bromocriptine or cabergoline therapy, write, which of the following tumors is most likely to, or which is the most appropriate medical therapy for this patient. There should always be a noun that describes the 5 options. If not, your item might not be finished yet, and you may need to replace some of the options. It is a problem when more than one option could be the key. This is less likely to happen when you include a current vetted reference and your discussion covers the key and distractors. There should be one best correct answer according to references and experts. This item covers 2 slides. First, let's look at the STEM. A 43-year-old school teacher and mother of 3 minor-age children has been treated for complex partial seizures, which she reports to be in good control. She has been the primary transportation for herself and her 3 children to school and to work. However, repeated serologies and a recent EEG suggest poor compliance. The initial best course of action would be to, and here are the options. In the item of the past 2 slides, there may be more than one key that experts would endorse as the correct answer. This can occur even when the author uses an acceptable reference. The options are somewhat heterogeneous, and this may contribute to the problem of more than one key. Making the 5 options homogeneous is likely to help. Sometimes it's tempting to write an item about a very new procedure or medication because you just learned about it and have enthusiasm. However, cutting-edge developments are risky test item topics because they may not be proven yet. Controversial keys also can be related to having more than one correct key if the field is not yet unified about the correct answer. The item shown is an example of a controversial key, even though the key isn't showing. Content experts may not agree on the most appropriate treatment option for the patient as described so far in the item. This item would require some revision prior to submission. Be sure your item has one best answer key that experts would agree upon and a current reference. If there are peripheral issues that are controversial, they should be included in the discussion section. Please keep in mind that if you revise your item, it is likely that your discussion will also require revision. Sometimes the reference too. Circular discussions say the key is the correct answer and the distractors are not. Excellent discussions explain why the key is the correct answer rather than just restating it. You should discuss why the distractors are not correct instead of simply saying they are incorrect. The circular discussion example reads, the patient has behavioral variant frontotemporal dementia, as the MRI clearly shows. The other dementia syndromes are not suggested by the MRI. Okay, examinees would already know this information by seeing the key. The corrected discussion provides a rich explanation of the key and distractors. The patient has behavioral variant frontotemporal dementia. This condition can be caused by a variety of underlying pathologies and is marked by frontal and/or anterior temporal atrophy, executive dysfunction, and changes in empathy, sympathy, hyperorality, or change in diet to more junk food. The history of being a difficult person does not change the diagnosis, and pre-existing personality issues that are not uncommon. The salient feature is that this is a change in behavior, ruling out personality disorder as the cause. While some of these changes can be seen in depression, disinhibited behavior is not generally seen. The discussion continues on this slide. The MRI clearly shows the classic atrophy pattern, which is not seen in the other dementia syndromes listed. Dementia of the Alzheimer type has mesial temporal and parietal atrophy, whereas posterior cortical atrophy syndrome has more posterior temporal and parietal atrophy. This rich discussion sounds like the author is interested in the topic. You should be interested in your own item, so be generous with your discussion. Ungenerous discussions will not inspire further learning or curiosity about a topic. Excellent discussions can stand alone, and the reader does not need to see the item. As such, discussion should include or restate the key. Unless it's redundant to do so, distractors should be explained separately. A good rule of thumb would be to approach your discussion as if you were talking to an interested colleague. The ungenerous discussion shown in the slide does not appear to include the key. The information is minimal or stingy, as if the author did not want to spend time explaining the topic. By adding just a bit more information, the corrected discussion shown invites us to ponder the topic. We clearly see that the approach of the key, observation, is set apart from the distractors, testing, even though the distractors are not explained individually. Uncommon references can frustrate examinees rather than invite them to further learning. Use references for your items that are available to many examinees. Current information is good, but classic sources might be appropriate for some content. The best references will vary by topic. Keep in mind that your exact item text may not appear in the reference, and that's just fine. The reference points to where the key and distractors are addressed, not necessarily the clinical information you include in the item. Finally, please remember that any items written for an AAN examination become the property of AAN and will be copyrighted when appearing in an examination. Please do not submit items that were written for another use or that appear in other publications. Your authorship is greatly respected and appreciated by the Academy, but the ownership of the items belongs to AAN. Are you ready to write some excellent test items? Let's do a quick summary of writing and reviewing your items. Recall that first drafts are rarely excellent. Make sure your item tests an important concept. Is the STEM positive and focused with no teaching? Are the options plausible and similar so they look alike to someone who doesn't know the answer? Is there only one key on which experts would agree? Also check your discussion and reference. Does the discussion cover the correct answer and the distractors? Does the discussion generously address the topic? If you revise the item, did you revise the discussion too? Would examinees be able to find your reference? Is the reference old enough to be accepted or replicated and current enough to be trusted and valued? Thank you. I hope you're inspired to write excellent test items for the American Academy of Neurology. First drafts typically fall a bit short of excellence, but review and attention to the points we've covered will bring your item ideas to fruition in carrying on the long tradition of excellence at the AAN. I wish you great success in your efforts.